week coronavirus outbreak in China is growing.
More than 40,000 people have been infected worldwide.
Growing fears over the coronavirus, health officials warning we could be on the brink of a global pandemic.
I am RV Sanchez from grade 12 St. Alfonso's Ligari, a student from St. Augustine Academy of Pampanga who suffered to cope and learn effectively due to the pandemic. An individual whose mental stability was severely affected during these trying times, and a resident of Barangay Gutad who faces uncertainties and challenges social cohesion among community members.
Community quarantine is hereby imposed in the entire of Metro Manila.
First and foremost, let us define first what is this virus. Coronavirus disease, also known as COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. The first known infections from severe acute respiratory syndrome coronavirus 2 were discovered in Wuhan, China on December 31, 2019. The original source of viral transmission to humans remains unclear, as does whether the virus became pathogenic before or after the spillover event. The confirmed case arrived in the Philippines from Wuhan, China via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing a mild cough. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require immediate medical attention. Currently, our barangay luckily has no active cases as of today, but we've peaked into having a total of 54 active cases and 6 deaths in our record based from the FB page of Florida Blanca Rural Health Unit number 2 Barangay Gutad. The COVID-19 pandemic demands that we remain vigilant in our daily lives as we return to everyday activities. We can each take some simple steps to protect ourselves, our families, and our communities. This includes wearing face masks in public indoor spaces and areas with widespread transmission of the SARS-CoV-19 virus. Avoid close contact with people, especially if they are sick. Minimize touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with the tissue, then throw the tissue in the trash. Clean frequently, touch objects and surfaces regularly. And lastly, wash your hands often with soap and water. This chart illustrates how protective measures such as limiting travel, avoiding crowds, social distancing, and true and frequent hand washing can slow the development of new COVID-19 cases and reduce the risk of overwhelming the healthcare system. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or even breathe. These particles range from large respiratory droplets to smaller aerosols. You can be infected by breathing in the virus if you are near someone who has COVID-19 or by touching a contaminated surface and then your eyes, nose, or mouth. The virus spreads more easily, especially in indoors and in crowded settings. There is now real hope that vaccines will help end the pandemic. But until it is over, we must stay vigilant and continue to protect our loved ones by wearing masks, physically distancing, and washing our hands often. I encourage everyone to cooperate and take part into rising through this onslaught that this pandemic brings. Be the solution. Be part of the solution. We have what it takes to end this global crisis, and it's on us to finally come together as one united society and be a better citizen for our community.